In this video, we are talking about baby head shapes and what to do and how to measure a baby's head shape if you notice flatness right away. We're gonna go over the 3 different types of head shape and things that you can do at home, depending on your baby's age, to help correct that head shape. Hi, I'm Dr. Lauren Baker, a pediatric physical therapist, and on this channel, we provide mini masterclasses for proactive parents and pediatric providers to help them uncover the movement blocks that are keeping their children from hitting their milestones. Think of me as your pediatric physical therapy bestie, here to help you learn tips and tricks to help your children move better. In this video, we are going through all the things. It is going to likely be on the longer end, so make sure you watch this video all the way through because this is something that can really change the head shape of your kid, and that's really important, and I want to make sure that our families on this channel are highly educated. If the baby had a C-section due to being breech, if there are multiple, if they're a boy, all of these things are going to increase their risk of having a head shape change. We also see some babies have head shape changes from their position in utero. If they were really low in the pelvis and they were kind of crunched up in there, then the position of the baby as their head grows can actually create changes in the skull shape. So we've got 3 different head shapes. The first head shape is going to be called plagiocephaly. That is when there is flatness on one side of the back of the head. This is usually due to a head rotation preference due to tightness in the infant's body. There is a 50% chance that any child is going to experience some type of head shape change, and that is often due to the Back to Sleep campaign, which has significantly decreased sudden infant death syndrome. So it's absolutely something we need to keep doing. However, there are sometimes unintentional consequences even with really good things. So if a baby has a head rotation preference, the most common is flatness on the right side of the head with a right rotation head preference. When you have that flatness on the right side, you may also notice an ear shift if you put your fingers right at the ear. The side that is flat, so say it's a right side flatness, your right ear is going to be forward, and that right front side of the baby's head is going to be pushed forward. This is showing flatness on the left side. And then you can kind of see here that they're sort of showing some more push forward left side, and you can see this left ear is a little bit more in front if I drew a line here in front of the right ear, and then normal is going to look like this. When we have an ear shift, we are looking at babies being in a moderate category, and we want to make sure that the muscles all attach in the right spot, because if they don't and there's an ear shift, then there's going to be more tension on different parts of the jaw, the neck, and things like that. We want babies not to necessarily have a perfectly round head, but to have as symmetrical of a body as possible so they aren't at a disadvantage compared to their symmetrical peers. So we've got flatness more likely on the right side, but you can have flatness on the left side. It's just less common. You do want to make sure that your provider is looking at their head shape and noticing any tilting of the head. So with right-sided head shape changes, you're often going to see a left-sided tilt and a right rotation preference. That is indicative of a condition we call torticollis. I'll link a full video on my breakdown of torticollis up here. The next option is babies can actually have flatness on both sides of their skull. This is called brachycephaly, and oftentimes these babies have a higher head height because of how the skull is being pushed forward. There's nowhere else really for the skull to go, and so it kind of gets pushed upward. The third option is you could have scaphocephaly, and scaphocephaly is really a very round oval shaped head shape. Some of these babies may have had a stay in the NICU And oftentimes they have a hard time keeping their nose pointed up towards the ceiling because their head is so round in the back. They are either rotated fully to one side or fully to the other side. And the big concern with scaphocephaly is you do want to make sure a pediatrician has looked at the baby's head sutures. They're the parts where the bones connect in the skull, because scaphocephaly can be a risk factor for craniosynostosis, and that's when the sutures of the head prematurely fuse and then the baby's not able to have their head grow in different directions, mostly wider. There are different types of craniosynostosis. We're not going to go over those today, but I want to make sure that you guys know some of these key words to bring it up to your pediatrician to make sure they have ruled this out. You see that your baby is starting to have a head shape change. What do you do? So the first thing that you want to note is it on one side or is it on both sides of the back of the head? When it is on one side, are they spending most of their time fully rotated over to the right? If a baby is 0 to 4 months, we can put them in a repositioning program that helps them rotate away from their preferred side. So if you have a baby who has a right-sided flatness, that's what most babies are gonna have, you want them to sleep in left rotation. Now, just repositioning their head is not going to be effective enough for them to keep it there, especially if there's tightness on the right side of their body that is constantly pulling their head back to the right. If they have left side flatness, we want them to rotate to the right. They are often going to have tightness on the left side of their body. That's going to pull them to the left. Now, I'm not going to teach the repositioning program on YouTube because it does deal with a baby's sleep and it's so individualized, and you really need to work with a pediatric physical therapist or pediatric occupational therapist that has been trained in repositioning programs. I've been trained in the Baby Begin method, and so if you are a provider or if you are a parent, Baby Begin provides international consultations for head shape, and I would recommend that you contact them immediately. I'll put their link up here as well as in the description. If your baby is 0 to 4 months, there is so many things that you can do. Now, the biggest thing with the baby's age is that if they are starting to show signs of rolling, usually in that 4 to 6 month range, you are going to be limited on the time that you have to really affect change in that head shape. The force of the mattress as they leave their head in right rotation is going to further change and flatten that head shape. It is only going to get worse if they keep their head over there. When we reposition them, we are able to then start having the mattress push on the back of the head on the area where there's the bulge because everything shifted over to the other side. And then we're able to try and deform that head back to more of a neutral position. If a baby is over the age of 5-6 months, they are likely going to need a helmet to make any changes because oftentimes they are rolling over and sleeping on their belly, or the type of repositioning program is not quite considered appropriate because they are moving too much. When we look at ages, we want to catch head shape changes as early as possible, and if we see any change on those head shapes, we want to get proactive action immediately. We do not, under any circumstances, want to wait and see. So if your pediatrician or healthcare provider tells you, oh, I'm noticing a head shape change, let's just wait and see if it changes at their 4-month appointment, hard pass. Absolutely not. You need a repositioning program by Baby Begin or an alternative method immediately so that you don't waste precious time and don't end up in helmet. If you do nothing, at 4 months, they still have a head shape change because you didn't affect any change on their head shape because you didn't do a repositioning program, then nothing's gonna change. More tummy time will help it not get worse, but it won't make it get any better because there's nothing pushing on that bulge part of the head, which is why the repositioning program is so important. 0 to 2 months is the most ideal time to change a head shape. 3 months, still great. 4 months, getting a little bit, you might get 2 to 3 weeks, and that might be enough, it might not be enough. 5 months, it really depends on the baby. 6 months, likely going to need a helmet to affect any change of their head shape. For everyone who knows, you can only affect changes to head shape up to 18 months. Typically after a year, it's very hard and your success rate, even with a helmet, goes down pretty significantly. So we want families to get into helmets if they want them before 9 months to make the most change. If you're in the significant range and you're 5 months, you probably want to get in a helmet as quick as possible. But if you are 0 to 4 months, you can definitely have quick change. Like my 2-month-olds that come to see me, sometimes 2 or 3 weeks. And we have like not a perfect head shape, but a normal head shape, because that's what we're going for. We're not going for perfect, we're going for normal. When we look at repositioning, we also want to make sure we're addressing the whole body. So if a baby does have a rotation preference, typically to the right, we want to make sure we are loosening up that whole right side as well as the left side. If the sternocleidomastoid is involved, you're gonna tilt to the left and rotate to the right. But if the whole right side is involved and your baby's kind of like this, then there's gonna be more muscles involved in that situation. And so a pediatric physical therapist or a pediatric occupational therapist that specializes in infants is going to be your best option to help your child, because we wanna open up all the muscles, head, neck, trunk, pelvis, everything, as well as affect change on the head shape. Plagiocephaly and torticollis often are like evil best friends and go together. We want to make sure we address both, because if we don't address one of the problems, then the other one is still going to be simmering under the surface, making our results in the one we didn't address more difficult. If you have flatness on the right side, gravity is gonna push you to the right side. So the more we change the head shape, the easier it's gonna be for the baby to keep their head in neutral with their nose to the ceiling, and it's easier for them to rotate to the left during sleep. Okay, so we've got all the things. How do we even know how bad or significant a head shape change is? One of my favorite things to do in all of my appointments with all of my infants is to use these Mimos calipers. Now there's a couple of different ways that you can get a head shape measured. I use the calipers personally because they're super easy and relatively quick. You can also download a couple of apps. There's Skully, I'll put a link below. They're out of I think the Netherlands, and so their turnaround rate is like within a day, so it's not immediate, depending on the time you take the photos, and you do need a kit to order. And then the third option, if you have any near you, is a hanger clinic or Cranial Technologies. Sometimes craniofacial surgeons will also have these, but it is a head scanner, and that can give you the most objective data. What is unlikely to happen is your ability to go there frequently to see progress if you're doing a repositioning program at home. So I do recommend either an app like Skully or my favorite, which is the Mimos calipers. I will link everything in the description down below, or if they're available, and the product links will be down right here. This video is going to go through head shape measurements both for plagiocephaly as well as for brachycephaly and scaphocephaly. Brachycephaly and scaphocephaly are going to be measured like a T, so they have the same type of measurements. It's just scaphocephaly is going to be considered something less than 76, and brachycephaly is going to be higher than 90. If you have a baby that has a flat spot only on one side, you're going to measure it more in an X, and that is going to be categorized in normal, mild, moderate, and severe categories of head shapes. Severe Another word you could use is just a significant head shape change. If a baby is in the moderate or severe/significant category, then we want to make sure that we are repositioning immediately. If they're mild, I still recommend the repositioning program, especially so that it doesn't get worse, because the more time they spend on the side that is flat, right side, right rotation, right flat spot, or left spot, flat spot, left rotation, the worse it's going to get. And we don't want that. We want to make sure that we are addressing flat spots as soon as possible. What you do is you place the arrow right above the baby's nose, and then you're gonna have 2 plus signs on the front and 2 plus signs on the back. You're also gonna have a circle on the back. When you measure the T shape, you're gonna measure between the arrow and the circle, so front to back, and then over each ear. So we got baby Eric, he's got the little headband on. I want to make sure that you guys really understand this. So I'm going to do a little bit more in depth here, and then we will go through and I'll talk you through the footage on the real babies. And if you turn them around, you want to make sure that it's kind of on the fullest part of the back and that it's in a relatively straight line. So when you're looking at measuring scaphocephaly, more of an oval shape head shape, or brachycephaly, flatness full on the back of the head, then you are going to measure in the T shape, and you're going to put one on the front of the arrow and the other on the back circle. And then the caliper has little tick marks. I typically measure 3 times just to make sure that the numbers are similar, because babies wiggle. And so usually this is a 2-person job. So you're gonna do this measurement, kind of look at it, do it 3 times, write down the most consistent number that you get, and then go right over those ears, get the other number, do that one 2 or 3 times, get the consistent number here so you can kind of see baby Eric like that. You are putting on the little headband. Babies sometimes hate it and sometimes are fine with it. This baby specifically is pretty fine with it. You want to make sure that it is level all around her head and that the arrow is pointing on the straight down on the nose. And this is ideally a 2-person job, but for this one, for brachycephaly, you're gonna go to the arrow on the front and the circle on the back. That's what I'm doing right now. And then you wanna make sure that the calipers are in the right spot so that you can actually see the numbers. And then you are going to do directly over the ears. Usually that is more of the widest part of the head. And you're basically looking at the difference between the width and the length of the head. So you're looking at the T-shape version. Usually I do each direction 3 times. This baby is really calm, so I am able to do it myself. But as she starts wiggling, you're gonna see that it's harder for me to actually like see exactly which tick mark the baby's head shape is measuring. And then you can take the headband off when you're done. This shows the numbers for brachycephaly. Again, that's gonna be the T-shape measurement, as well as scaphocephaly. So this does not have scaphocephaly, but if you do the same measurement and you get the cephalic ratio, if it's less than 76, I would make sure that someone is checking the sutures so that the infant is not at risk of craniosynostosis and those sutures are moving. And then I would go to Baby Begin and look up their trough method to help that baby kind of flatten that back out just enough so that they can keep their nose pointed to the ceiling without falling into rotation for up to 2 minutes as they're like closer to that like 1 to 2 month range. When you measure with the plagiocephaly or the X shape, you're gonna go from back right to front left in a diagonal and back left to front right. When you're looking at plagiocephaly, where there's flatness just on one side of the head, I usually name it by the direction of the baby's head. So this is the baby's back right and their front left. So you can kind of see that it's at an angle a little bit. So I'm gonna do that 3 times, measure it. And then back left and front right. And I'm gonna do that 3 times and measure it.
This one is a head shape measurement on a 2-week-old. This is actually the most ideal time. I apologize for a little bit of the shakiness. My brother is taping his newborn and we are measuring my nephew's little head shape, and that's my little niece. So that's my husband. So it's a family event, but you got the little headband on, and you really want to measure head shape as early as possible, usually within the first month, especially because babies' heads are so malleable. You can see here that we brought his head a little bit to the end, and this is clearly a 2-person job. I'm going to measure for plagiocephaly here, where we're doing the back right and the front left. That's the one I'm looking at right now. I'm looking at the little tick marks, and I'm going to do it 2 or 3 times to really make sure that I'm getting the same number or close. And I've got my little pad of paper there, and on it I have like front left, back right, and then I'm going to measure front right and back left. Get my sweater out of the way so I can get it right on there. Oh, my little sweet nephew is so small and so cute, you guys. We even have the dog. So I really wanted you guys to just see that this is so important. This is something that I do for my family members. I do for my best friends' kids. If I'm in town, I'll just bring my tools with me. And you just want to have some really accurate data to make sure that that head shape is in that normal range, or to help families address that head shape earlier if we need to. So if they're within that first 2 months, then we can put a repositioning program in place. In this case, we didn't have to, but if we did, we would have had enough time in order to do it that we could get really great results.
So when we go to take measurements, first we're gonna look down here. When we look at plagiocephaly, we're looking at that T shape. And so you take diagonal A. Usually when I write it down, I write like left, front, right, back, line. Left, back, right, front, line. And so that I know which ones I'm measuring, because diagonal A and diagonal B doesn't necessarily mean anything to me. So you're gonna have one line here and the other line there. You're gonna do A minus B, or the 2 numbers you got minus each other, times 100 and divided by the number that is greater. That is gonna give you a value, and that value is gonna be based on the CVAI. This is not the only measurement that can indicate head shape changes. However, it is the easiest one to do at home. The other numbers or values you would get if you got a head shape scan from Cranial Technologies, Hanger, or a craniofacial surgeon's office, usually connected with a bigger hospital. So if it's less than 3.5, totally normal. Again, we're not looking for perfect head shapes. We are just looking for normal head shapes. If it's 3.5 to 6.25, we're in the mild range. If they're less than 4 months or not rolling yet, we want to do that repositioning program. My favorite is the Baby Begin method. And again, you can take their course if you're a provider, or you can schedule a consultation with them and they can teach you how to do it. If you are 6.25 to 8.75, that's gonna be in the moderate category. That means there's probably an ear shift present. You can probably tell, okay, the right ear is more forward than the left ear if you have flatness on the right side, or the left ear is more forward if you have flatness on the left side. That, if they are 0 to 3, 0 to 4 months, you still want to do a repositioning program immediately if you can. If they're over that, you do want to get a head shape scan as soon as possible so that you can get them in a helmet if they're 5, 6, 7 months. If it's 8.75 to 11, this says that you should refer them directly for a helmet. If they're 0 to 2 months, maybe even 3 months, you can give it about a couple of weeks to see if the repositioning program is effective. I have had kids go from like a 13.5 down to a 5, and even like sneaking closer to the 4s, and families notice, okay, there's no ear shift, we don't have any facial changes, I'm okay with this, we're just borderline between mild and normal, I'm okay with how this head shape is, and choose not to get a helmet at that point. Heads are going to continue to change and grow as the baby gets older. However, once they're sleeping on their belly, they're not going to likely get better. They will likely just stay consistent, right? So if you're at a 13.5 and your baby's sleeping on your belly, your only option is a helmet. And then over 11 is very significant. Again, depending on their age, the younger they are, the more successful you'll likely be in repositioning. If they're over 5-6 months, you do want to get into a clinic that can do a head shape scan as soon as possible. Honestly, I would love for families to have the tools to measure their infant's head shape anytime they wanted to. So these calipers are available on Amazon. I will link them in the description down below so that you guys have access to them, so that if you do want to monitor your baby's head shape, you can. Because the earlier we have objective data, the better decisions we can make and the earlier intervention we can give to these infants. And that's a wrap, friends. Thank you so much for taking the time with me to go over the 3 different baby head shapes and what to do and how to measure them and what options that you have in order to help your baby fix their head shape and to take proactive action, especially if you're a proactive parent or if you're a pediatric provider looking for ways to better serve your infant client. If you have any extra questions, make sure that you check the pinned comment. That's where you're gonna find a link to schedule a one-on-one consultation with me. What I will say is that if you're looking for a consultation on someone to assess your head shape, I would refer over to Baby Begin, because that's all they do all day. They have a ton of providers. And when you're making an appointment for a head shape, time is of the essence. And so I'm confident that they would be able to get you guys in, maybe even a little quicker than me. If you are looking for some really good mobility screens for your infant, make sure you check out the TMR playlist up above. It's all of my favorite mobility, flexibility screens and treatments for infants to make sure that they are moving in all the ways they need and decreasing any tightness that is causing their little bodies to struggle with movement.